keeping your vitamin D level optimized was extremely important to preventing respiratory infections like COVID-19.
Welcome to Startup Health TV. This is a COVID-19 health innovation update. I'm Logan Plaster, and I'm joined today by Bob Wise, CEO of Soleus. I'm excited to dive in and hear about what Soleus is doing in regard to COVID-19. Bob, thanks for joining me.
Well, thank you for having me.
So you're in Seattle, one of the ground zeros. I mean, now New York is obviously exploding, but Seattle was considered sort of a ground zero. How are things going with your company and with you personally right now?
Well, personally, with the company, fortunately, everybody is healthy. We closed our offices a couple of weeks ago, and so we've been practicing a lot of isolation, and because of that, I believe that we've all been able to retain our health, and we're very thankful for that. But thank you for the concern, and clearly, everything going on in Seattle, people are very nervous.
Yeah, very, very much so. So I'm glad to hear that. So Soleus, very interesting product. We've written about you in the past, a walk-in booth where you get all of the benefits of the sun without any of the bad radiation. I wish I had one in my home during those dark months. But recently read a headline saying that this vitamin D boost has really been tied to some good benefits during COVID-19. So I'd love to have you walk through the connection between this product, this Soleus booth, and COVID-19 response.
Well, for a long time, people have known that sunlight is very important to good health. And the problem with sunlight is that there's also extraneous rays that come with it that can cause skin cancer and aging. And so what our product does is it's a phototherapy device for delivering a very narrow spectrum of sunlight. That particular spectrum is the peak production area for vitamin D in the human body. One of the things that people don't typically realize about vitamin D is it's not a vitamin. It's actually one of the master hormones of the body. It was misnamed when it was first discovered.
Hmm.
And so it's critically important for people to have their vitamin D levels optimized. But unfortunately, because of the fact that we've moved north, we work primarily indoors. And when we're outside, we tend to cover up and wear a lot of sunscreen because we're afraid of sunlight these days. And the right amount of sunlight is actually very healthy for you. So the product was designed to give you the peak rays from the sun that produce vitamin D. It's a very narrow spectrum. We do that inside a phototherapy booth that you walk into. It takes about 3 minutes, and it's extremely important for your immune system and a number of other conditions that have been correlated with low vitamin D or vitamin D insufficiency. One of those key areas in your immune system is your respiratory function, and there's been a number of studies. And in fact, the former head of the Center for Disease Control yesterday published a very interesting article about the fact that of keeping your vitamin D level optimized was extremely important to preventing respiratory infections like COVID-19.
Hmm. Very interesting. Um, so even beyond the use of Soleus as a booth, I mean, this is something that anyone should know more about. I mean, this is a way of sort of taking care of yourself.
It's super important to take care of yourself. Everything from osteoporosis to other types of autoimmune diseases, including multiple sclerosis and psoriasis, in addition to respiratory diseases, have all been correlated to low levels of vitamin D. And the fact is, almost everybody in the United States, about 72% of them, have been proven to have low vitamin D levels. And as I mentioned before, as we continue to work indoors and not get outside during the peak rays of the sunlight, that problem is continuing to get worse. It's not just a problem in the United States, it's actually a global issue. And we see it in almost every country issue, but particularly in the northern climates too.
So you've created this product. It's kind of this futuristic walk-in, a pod. This pod.
Yeah,
I'm trying to find the right words. I've
yeah.
seen the pictures. Very cool. You can sit down. You can stand up. I think you can get the light therapy. So you had this going, all these good benefits, and now you're seeing this connection to COVID-19 to respiratory distress. Um, how are you connecting those dots? I mean, what happens next with that knowledge?
Well, what we really need to do is we need to do additional studies to show the linkage there and to show that we can improve that. We're fortunate in that our product has actually been approved in Canada. We have a license in Health Canada. The product is available over the counter. Anybody can walk in and use it. Obviously, that's a little difficult these days with the travel bans in place,
Mhm.
but in the pharmacy type locations where you can currently see our machine, those facilities are open and people can go in to use it. We are pursuing the same kind of approval in the United States, but that's a long process with the FDA. And we also realize that maybe from because of the travel issues that we're seeing these days, it's important that we scale the machine to allow an in-home type of form factor, which is something that we're working on right now, so that you can actually have the benefits of this device without leaving your house.
Okay, so it's approved. It's able to be used in Canada. How much of a rollout? How early are we in that process in Canada?
Very early. We've just started actually up in Canada, but we have people using it and to rave reviews at this point. We are also able to use it here in the United States under the auspices of a review board, a medical review board for a clinically led study. And we're going to be doing that. We're moving forward very quickly to get approval to have people in the US come in and use the device as a preventative method, particularly important here in the Seattle area with the spread of the disease.
Sure. So thinking ahead to a post COVID-19 world where we're preparing for the next pandemic, where would you like to be a year, 2 years from now? Let's say Soleus is approved as a therapy in the US, and we're sort of looking ahead to the next respiratory illness. If you could wave a magic wand, what would that look like in terms of incorporating Soleus into the solution?
Well, we really think that people need to keep their immune system boosted and operating at peak functionality. So, what we would like to see are thousands of machines deployed into location partners around the US. And for those people that don't want to go out to actually use the device, we want to have by that period of time, sometime in 2021, we want to have our home device approved for usage and that we can ship that directly to you so that you can spend 3 or 4 minutes a week just making sure that your immune system is in top shape.
Now, just how effective is it? How much of an assist is it if you're concerned about coming down with a respiratory illness? Is this just sort of taking me 1 degree healthier, or is it a pretty big boost?
Well, I don't think I can really give you a clinical answer at this point. We don't have the scientific studies to back that up. The marker that we measure, though, is 25-OHD, which is the precursor of vitamin D
Mhm.
in your blood. And we can show that we are able to boost that within a 1 month period using the machine just once a week. Our clinical studies have shown that we're able to actually increase your vitamin D level by 20% in just 4 weeks.
Wow. Okay. Okay. Well, that's where we're gonna stop for now. If people want to collaborate with you, if they want to learn more, where should they go online, and who should they reach out to?
Soleus.com, and we have a link right there to get in touch with us.
And next steps in terms of what would be an ideal next collaborator? Who do you hope reaches out to you right now?
I think we're looking to speak with medical professionals, principal investigators in the areas of respiratory functions, multiple sclerosis, other autoimmune diseases, investors, and of course, if there are individuals that want to use the machine, we'd be happy to direct them where they can do that.
Excellent, excellent. Well, I love to see what you guys are working on. Love to see these new applications of vitamin D and of light therapy. So keep up the amazing work. I'm glad to hear that your team is safe, and I wish you all the best there in the Pacific Northwest.
Well, thank you. Same to you and your family.
All right, take care, Bob.
Cheers.